everyone that's watching. Welcome to the Ape Alliance panel discussion. For the first time, we're holding this online due to the current pandemic, which is great because it makes it accessible to people all around the world. This year, our expert panel are going to be discussing how zoonotic diseases, specifically the current outbreak of COVID-19, are related or affect ape conservation. So I'm Iona Haynes and I'm the coordinator of Ape Alliance. The Ape Alliance is a group of over 100 organizations and individuals all working together for the shared goals of ape conservation and welfare. Before we start, I thought I'd give a quick overview of some of the terms that we're going to be using, just in case some people don't know them, to get people up to speed. So we all probably know what COVID-19 is by now. It's the infectious disease caused by the most recently discovered virus in the family of coronaviruses. Coronaviruses are a large family of viruses, several of which cause respiratory diseases in humans, from the common cold to the more rare and serious diseases like SARS and MERS. Many coronaviruses infect several animal species as well. SARS infected civet cats, and MERS was found in camels. A disease which is like these, which is regularly transmitted from animals to humans or humans to animals, is called a zoonotic disease. Currently, scientists aren't certain of the zoonotic cause of coronavirus, but there's evidence suggesting a link to bats and pangolins. Apes, in case you don't know, are a group of primates split into great apes, humans, gorillas, chimps, bonobos, and orangutans, and small apes, gibbons and siamang. All ape species are endangered or critically endangered. Scientists predict that apes can catch COVID-19 because they are our closest relatives and can catch many of the same diseases as us. Thankfully, to our knowledge, so far no apes have contracted COVID-19, but many primate species are susceptible to similar viruses and other pathogens. I'm now going to pass on to each of the other panelists in turn so they can introduce themselves and the work that they do. I'm going to start with Ian Redmond, Ape Alliance's chairman.
Thank you, Iona. A very clear introduction as to why we're here and what an extraordinary occasion this is, because this is Earth Day. I wish everyone who's watching a happy Earth Day, and how sad that we're all locked up in our homes, and if we're lucky enough, gardens, to experience Earth Day. And perhaps this period of reflection that the COVID-19, the measures taken to reduce the spread of COVID-19, it gives us a time for reflection. And as we look out of the window at the surprisingly clear air and the surprisingly pure water that is now around us, many people are wondering, well, is this actually just the boot at the backside that the human species needed from nature to tell us to change our habits? So I chair the Ape Alliance because since the mid-70s, I've been involved with ape research and conservation and filmmaking, and that's how this group of organizations got together, because it was clear that there were different organizations trying to help different species, and some of them in amongst trying to help the whole biosphere. Some coordination and collaboration could be useful, and what you see this evening is an example of that. So the evening is going to be a very brief introduction from each of us, and then the opportunity for some questions we've already received. You, the viewers at home, and we understand that there are potentially 800 or more viewers in their various homes around the world, can type in questions. But before I go any further, I'd like the next person to take the floor to be Jo Thompson, who wants to just explain a little bit about herself and about Earth Day. Jo, over to you.
Thank you, Ian. First, I wanted to thank Ape Alliance for inviting me to be a panelist here. For Ian and me, meeting this way is a decennial occasion. First at the Great Ape event in year 2000, and then Hope for Apes in year 2010, both hosted by Ape Alliance. Today, however, I wanted to say that I feel privileged to be a part of this esteemed panel, which includes so many of you who are longstanding friends and colleagues. For those who don't know me out there, I'm a wildlife ecologist who has spent 3 decades in the Democratic Republic of Congo, working through the Lukuru Foundation engaged in bonobo conservation. My field site initially brought me face to face with Ebola during outbreaks both in Kikwit in 1995 and the Luebo Mueca area in 2007. So that's when I first got involved in surveillance of emerging disease. I'm currently speaking from the United States, where I'm working on a second doctorate degree. This one's in molecular genetics. So let me just say really quickly about Earth Day. Today is the 50th anniversary. Many of you were not alive when Earth Day was first celebrated. In 1970, the original organizers of the first Earth Day were not necessarily environmentalists. They were a great variety of people, including policymakers, industry giants, and people from all walks of life. But what brought them together was the response to what we could see here in the United States as blatant environmental devastation. And some of those events included a massive oil spill off the coast of California that killed tens of thousands of birds and other animals, a massive fish die-off in our Great Lakes, just north of where I am today, rivers literally on fire from pollution, again, not far from where I'm sitting today, and many more things. The decade that followed saw some of America's most powerful environmental legislation. Some of those things are the creation of the Clean Water Act, the establishment of the Endangered Species Act, the Environmental Protection Agency, and many other things. The first Earth Day was a catalyst, and its relevance quickly became a global phenomena celebrated around the world. 50 years later now, we have some different but similar, broader, bigger environmental challenges. Most notably, the things that I am most aware of today are the current pandemic that brings us here today, environmental disruption, population growth, which is at the root of all of this, climate change, decertification, and global leaders who deny the impact of our behavior and politicize global health. Today, we are starkly reminded that nature, with a capital N, can swiftly transform our lives. We must do more to protect our global family and Mother Earth. Thank you.
Thank you. So now I'm going to pass on to Jim Desmond to introduce himself.
Unmute myself. So, hi everyone, my name is Jim Desmond. I'm a veterinarian. I'm a consultant with an organization called EcoHealth Alliance, which is based in New York City. I've been working for them for over 10 years, primarily on studying emerging diseases and the factors that contribute to emerging disease events like the current pandemic that we're all experiencing right now. So I've worked in China, in some of the markets in China, where people think that this may have emerged from, but also all around the world, studying really, when you think about these spillover events, it's caused by multiple factors, but obviously it's human behavior, and some of the behaviors that are most important is sort of the interface where a spillover event might happen. And so that's what we try and get down to the bottom of, is figuring out these factors that contribute to these events so that we can try and prevent them in the future. And then the other thing that I do is my wife and I founded an NGO called Liberia Chimpanzee Rescue and Protection. So I'm currently in Liberia right now. We have a chimpanzee sanctuary. We work very hard also on law enforcement here because there's a lot of bushmeat hunting. So even in this part of the world, there's a lot of hunting, and then that creates this other market for people eating bushmeat and these other value chains where people become potentially exposed to diseases like coronavirus or other diseases that might cause a pandemic. So that's my background. Thank you.
Thank you. Johannes, would you be able to introduce yourself, please?
So yeah, my name is Johannes Rehfisch. I'm a trained ecologist. I work primarily in Eastern DR Congo and in Cote d'Ivoire. I'm now leading the Secretariat of the Great Apes Survival Partnership. That's a UN-led partnership for the conservation of great apes and their habitats. It's a UN-led effort. The Secretariat is provided by UNEP and UNESCO, and our partners include the UN Convention Secretariats, Convention on Biological Diversity, Convention on Migratory Species, CITES and others, the 23 Great Ape Range state governments, more than 50 NGOs, private sector, academia, and we are all united to try and conserve great apes and their habitat. So we work around 6 priority areas. That's law enforcement, judiciary, habitat protection, advocacy, disease, conflict-sensitive conservation, and green economy. So you have heard disease is one of our priorities. So as an example, at the peak of the Ebola crisis, we partnered with Siv Einar Leendertz, and she published a scientific review of what is known about Ebola and the impacts on great apes, and what are the possibilities for vaccination. And those results were fed into a GRASP publication on Ebola and great apes. So I do know that today we don't not only talking about Ebola, it's about COVID-19. I fully understand, but there are certain elements we can learn. But I want to talk more about the link between the environment and the emergence and spread of zoonotic diseases. So GRASP has been involved in developing a statement for IUCN, the Primate Specialist Group section on great apes, and the Wildlife Health Group in IUCN on COVID-19 and great apes. We also contribute to short communication to Nature, and currently we are revising or updating a chapter on zoonotic diseases in the UN UNEP Frontiers report. So what I would like to talk about today is a little bit the link between environment and the spread or emergence and spread of zoonotic diseases. As we all know, Africa is under massive change, a faster change than any time before. Bill Lawrence published a map with 33 development corridors planned south of Sahara. This has a lot of unintended consequences, often as a byproduct, illegal trade in live animals or in wild meat. And obviously sometimes there is a link between consumption and trade in wild meat and disease. There are other consequences too. There's increasing evidence that there's a link between environmental degradation, let's say habitat loss, biodiversity loss, and the spread of diseases. Often the mechanisms are not known yet. So what I think we need is more disease monitoring to create a baseline and then to accompany the whole transformation process, because if we don't understand the mechanisms, how can we fight a new disease? So I'm probably also here to represent UNEP and GRASP and look at the policy side. So all these changes should have an implication for what our policy says and what we do in development planning. So I want to stop here and hand back to the moderators, but I'm more than happy to elaborate more around what can we do better in policy development and development planning. Thank you.
Yeah, well, there's definitely going to be some questions relating to that later in the discussion. So Vernon, would you like to introduce yourself?
I'm Vernon Reynolds. I started the Budongo Conservation Field Station in 1990 and been going ever since. Now, today I just want to focus on the vet side of things. Okay, so I hope you're all seeing the Budongo Conservation Field Station logo.
Yes.
Good. Okay, so this is just our logo, just to get us started. Now, our camp, which is in the Budongo forest in the middle of Africa, in Uganda, Western Uganda, not far from Lake Albert. We have a dozen buildings. There's 2 buildings you see here. Now, the one on the left is our veterinary laboratory, a nicely equipped laboratory we set up some years ago. Now, the vet lab, here we are inside it. We have vet interns who come from Makerere University, and we train them on field and wildlife vet at Badongo, or at least when I say we train them, is our vet who trains them. And here's our vet, Carolina Simwe. She's been our vet for some years now, and she runs the vet programs. And in fact, she set up a national program for chimpanzees. So if I just show one more slide, that's all. That is Uganda. Not a very pretty slide, I'm afraid, but there's Badongo. I don't know if you can see it at the top. Badongo Forest, where we have a couple of sites. Well, actually, we have 3 sites, not 2, where we monitor chimps. Further south is Kibale Forest, where we have 4 sites, not 3, and these are the ones that are listed here on the right of the picture, right of the map. And then finally, Kalinzu Forest down in towards the south of Uganda, southwest. So altogether 3, 7, 8 sites where our vet Caroline goes to monitor chimpanzees frequently. Well, not frequently, but she goes several times a year and monitors the health of chimpanzees there. I think I'll stop there. It's just giving you a feel for what I do. I want to pick up in particular on the recent outbreak last year of a very, very serious respiratory disease we had, which Caroline and her team collected good quantitative data on. So I do have quantitative data, not on COVID, of course, but on a related or another, let's say, virus, respiratory virus, from which we can draw lessons and implications for what might happen if COVID-19 were to reach the Badongo chimps. Okay, let's leave it there. Thank you.
Thank you very much, Vernon. Gladys, would you be able to introduce yourself?
Gladys Kalema-Zikusoka, founder and chief executive officer of Conservation Through Public Health. We started CTPH in 2003 because we were concerned about disease spreading from people to gorillas. While working as a first vet for the Uganda Wildlife Authority, we had a scabies skin disease outbreak in the gorillas, which resulted in the death of a baby, and the rest only recovered with treatment. It was eventually traced to people living around the park, where the gorillas picked it up when they went to community land. And so we've been operating for coming to 17 years now. And I look forward to being on this panel to talk about the work that we're doing to continue to spread other diseases such as COVID between people, to prevent the spread of COVID and other diseases between people and great apes.
Thanks, Gladys. We have a bonus panelist, especially as our panel was very biased towards African apes. We didn't have any Asian apes experts. So Ian Singleton is filling that void. Please introduce yourself.
Firstly, I'd like to say that it's gone midnight here, so if I'm waning at any point, please excuse me. But yeah, I'm kind of been working with orangutans here in Sumatra. Been now more than 30 years with orangutans, first in a zoo setting, working for Gerald Durrell at the Jersey Wildlife Preservation Trust, as it was then. Then studied wild orangutans in northern Sumatra in Aceh province, which was famous for the tsunami in 2004. And since 2001, I've been working on a thing called the Sumatran Orangutan Conservation Program, or SOCP, which is basically engaged on all aspects of orangutan conservation here in Sumatra, from confiscation and rescue of illegal pets to reintroduction to create brand new wild populations of the species, which is particularly relevant now because I always refer to them as a safety net should catastrophe befall the wild population. And I never believed that I would actually be sitting here thinking that a catastrophe may be about to befall the wild population. So that work is extremely poignant right now. but we also, our priority is always preserving and protecting the wild populations, and education and research and scientific data collection and accumulation and assessing the threats and habitat monitoring and all these different things. So we're a very holistic program. My reason for joining today is because we're right at the coalface of this whole epidemic. It's nice to be with some old friends who think on the policy level, but we are actually having to put into place plans and strategies to deal with potential outbreak in our own quarantine center tomorrow morning at 9 o'clock, for example. So it's nice to be involved. I don't claim to represent the Indonesian community. There are a lot of other very capable and very active Indonesian NGOs out there working in different projects in Borneo and Sumatra, the Indonesian government as well. I mean, I'm working here and I can comment and make statements based on my own experience working in Sumatra on our Sumatran orangutan conservation program, but I should kind of keep it at that. But my reason for joining is because we are facing difficulties on a day-to-day basis right now, new challenges, new expenses, potential drops in funding, more orangutans than we've ever had to care for before because we can't release them and move them, and all these different issues. So thanks for letting me join in.
Okay, so now we have introduced everybody. I am going to start asking the questions both from you on Facebook and ones that some of the Ape Alliance volunteers have thought of before the discussion. So the first question, I'm going to direct it initially towards Jim. So how do we know that apes can catch COVID-19 if there have been no apes confirmed to have it so far?
Well, we suspect that there was a paper published in the last few days where it shows that many primates, not all primates, but many primates, all the great apes, have the same receptor. It's an ACE2 receptor. That the coronavirus, some people probably heard on the news, they talk about the spike protein. It attaches to this receptor, and that's how the virus gets into the cells. So all great apes have the same, like 12 important points on that receptor that humans have. So although we don't know for sure, because there are no reported cases as of yet, and we hope there won't be, it's likely that it will infect all the great apes and some primates. We don't know what sort of clinical disease it might cause. Certainly with people, we're seeing obviously wide variation. Some people are showing no clinical signs. Other people are obviously dying and becoming very sick. So I think all of us probably, and probably people watching, I mean, we really don't want to find out because it could be a complete disaster for chimpanzee and other great ape populations around the world. If it has the similar effects that it has in people, it would be a terrible disaster for wild and captive apes.
Does any of the other panelists have anything to add to what Jim just said?
I think there was a publication in 2018 documenting a case where a chimpanzee in Cote d'Ivoire died of OC43. So its owner family, and obviously that virus was transmitted by humans. So I think that's a very good indication that we have to assume that great apes can contract the virus and the disease.
In Ape Alliance, we also work towards protecting lesser or small apes. Do you know anything about? Is that likely to be similar to the great apes in terms of how they would catch COVID-19?
The paper that Jim mentioned concluded that all the old world primates were susceptible. So not just apes, but also monkeys, macaques, baboons, but the New World primates, the ones in Latin America, South America, seem less likely to, because they have slightly different receptors. So it may be that it's primarily a threat to Old World primates. But what I wanted to add, while I've got the floor, is that if this disease does get into a wild population, it's not just the mortality caused directly by the disease that we need to worry about. When humans catch a disease, other humans will help them, will feed them, will, if necessary, intubate them and breathe for them until they are either going to get over it or not. But in the wild, the apes might just be feeling rubbish, and that wouldn't in itself kill them, but it might make them more susceptible to predation by whatever predators are capable of attacking them. And what is particularly worrying, because of the case at the Bronx Zoo, where a tiger tested positive for COVID-19, is that if some predators, some big cats, and who knows how many other species are susceptible to it, then a monkey or an ape that is ill, perhaps not going to die, but just ill, is more likely to be preyed upon by a tiger or a lion or a leopard, depending on the habitat. And there are some places where lions overlap with ape distribution, but more likely in Africa it would be a leopard. But in Asia it could well be a tiger, and particularly where Ian Singleton works in Sumatra, where you have Sumatran tigers, a critically endangered species, that might be infected by Sumatran orangutans, a critically endangered species. And again, the same thing applies. The tiger might not die of the virus, but might be feeling so rubbish with the disease that it can't prey it can't hunt properly. Consequently, it will lose condition and die of secondary complications rather than the virus itself. So that the risk that really scares me more than I can say is that the disease gets into a primate population, and then because those primates fall prey to predators, into predator populations, and it has a much wider negative effect than we're currently thinking of.
Thanks, Ian, for that not so cheery message. So because of all of this, apes very likely being able to be infected by COVID-19, I think I'm going to direct this question towards Joe or Vernon. So what would you say would be the main impacts of COVID-19 on ape conservation? So obviously population loss from death, if that happens when they get infected, but are there any other impacts that are likely?
I want to take this opportunity, a great opportunity, to tell you about the respiratory problems we've had at Budongo. We've been monitoring since for at least 2015 to 2019 data. I have data for those years. And we've monitored 8 communities of chimps in Uganda, 6 of which have had respiratory diseases. And the constant factor has been contact with humans. They're habituated, in other words, they're habituated communities. It can be tourists in some cases, but it needn't be. Our Budongo project doesn't take tourists, for example. And when it's not tourists, it's forest edge communities. Most forests with apes have villages around them, and people go into the forest to collect firewood, to set traps, to poach animals, etc. Well, the 2 main classes of respiratory disease, I'm sure you all know, are upper respiratory disease and lower respiratory disease. Most of the disease outbreaks we had in Uganda were upper, and adenovirus is particularly common. And adenovirus has not been fatal. it has caused severe bouts of coughing and sneezing and various other things, but chimps have recovered. Lower respiratory tract infections are much more serious. And that is the danger, of course, with COVID, which becomes a lower, after being an upper, becomes a lower. To our surprise, in looking at the data, we have found that adult males and especially senior adult males are most affected by respiratory disease. This is the 2019 infection at Badongo. Sonso is one of our communities that we study. As you see, we wear full PPE when going into deal with a sick or dying chimpanzee in the forest. And this is an important thing, which we must provide ourselves with full PPE at all our chimp field sites if we're going to have to tackle this infection or any future infections. Just continuing. This picture shows squibs. Squibs are one of our senior adult males who died in 2019. One of 4 who died. We lost 4 of our very, very best males. Just looking at the little box of statistics, it's giving you infection rate there. 59 of 67 individuals infected, 88%. So it was a serious illness. And fortunately, not that many died, but the ones who died were these lovely males. And then just looking at age and sex breakdown here on the left, you've got the sex breakdown with a statistically significant excess of males over females. This is for infections here, not deaths. But it would apply to deaths too, as a matter of fact. And then on the right, you've got age. And as you see, there's an enormous discrepancy with adults becoming much more frequently infected, although infants too are quite seriously impacted by respiratory infections. Now, one thing I must not forget to say is that we now know, recently found out which of the viruses was responsible for the serious the deaths and last year in this Badongo epidemic, and it is rhinovirus C26. That's genotype 26 of rhinovirus, and that is a human disease too. Humans can carry that, and no doubt a human being with rhinovirus carried it into the forest. Rhinovirus C has previously been found in chimpanzees in Kibale Forest. There's a paper on it in the journal Emerging Infectious Diseases, volume 24, number 2, 2018. So we aren't the first to suffer from rhinovirus, but there you have it. I'll stop there. That is the evidence we have accumulated in Badongo, in our national chimpanzee unit at Badongo for Uganda, and it shows what viruses have been able to do. These are all respiratory viruses I've talked about, and sets the scene for this current outbreak, I'm afraid. Okay, that's me done for. Now I'll hand over to Joe.
Can you just real quickly recap the question? Sorry.
So we were wondering what are the main impacts aside from death of individuals on ape conservation of the coronavirus pandemic?
Okay, thank you. Well, first of all, in our field sites, we have 8 main sites where we work from. We do not habituate, we do not have tourists, And so these are non-habituated bonobos that we're working with. Basically, our main interactions with them are nest counts and camera traps, trail cameras. So we don't have close proximity to them. Because we have a long history in the Democratic Republic of Congo with Ebola, monkeypox, so many diseases, I think that we came into this much more prepared or thinking about it than most people. Whenever we have somebody come from outside, they are under a 2-week quarantine, but primarily we don't have people coming and going. What we are doing right now is just ramping up our education. And we did a risk assessment. So basically we looked at, because I know that the IUCN grade ape section recommendations were to reduce field work. I'm probably not saying that right. Johannes, you can correct me. But we felt that looking at risk and benefit assessment, it was not worth the risk of poachers to have our teams come out of the forest. Also, subsequent to this, what we're dealing with in the forest is the main food chains, the supply chain for food for populated areas. And when I say populated areas, it's nothing like towns or cities. It's just markets and villages that have larger numbers of families. But the access to supplies has been cut. A lot of stuff came from China. A lot of things, cornmeal, things like that were imported, and those things have stopped. So there's price gouging. So the human beings' nutrition and their access to food has been cut. And that impacts wildlife because we work with forest-dependent people, which are just by the logistics of it, are lower density than towns and urban areas. So what we're doing now is continuing our research. We aren't bringing in new people. We're not moving people around from place to place. The ones that work in one particular patrol area stay there. But we have to continue the biomonitoring patrols because of the threat of poaching and the demand for food by people who would otherwise have access to food sources. Now, I'm going to try to do a quick screen share. One of the interesting things that has happened in recent months is, in the last couple of months, we've had a mature female, post-adolescent bonobo who has acclimated to our patrol teams, has become a visitor on a fairly regular basis to a village where there are people. And she is not afraid. I don't know whether she realizes that we are there to protect her or what, but she has started frequenting the villages. I don't know if I can, and here she is. She walks along the trails. So we've had to take some steps to haze her, to get her to stop visiting. And so that's an odd kind of a complication. But risk assessment, and for what we deal with, we have to keep patrols in the forest. We have to keep our teams in the forest. We have to keep our teams healthy because not only does it risk spreading disease, but when we have a patrol member out of the patrol, that limits our ability to patrol. So we have a lot at stake that you wouldn't normally think of.
So Ian Singleton has his hand up. So Ian, if you want to talk.
Yeah, if I remember, the question is like, what's the potential implications of infection in the apes? Yeah, orangutans are usually considered to be a low risk of infection because they're relatively solitary compared to the other apes, and yet there are contacts, of course. We are currently introducing orangutans into the south of Sumatra, where previously they existed but were probably wiped out by hunting, but also in the far north of Sumatra in Aceh, in an area called the Ulu Masin ecosystem, where there were no orangutans before we started. And yet those forests are extremely rich, there's abundant food, and they're connected to the forests of the Lothar ecosystem, which has the remaining Sumatran orangutan wild populations. So that I've always been wondering why there are no orangutans in this Ulu Masin forest. There's no ecological reason that makes any sense whatsoever. And there's no tradition of hunting people in this region either. The only thing that makes sense to me is disease. And the first point of call, everybody knows that when Europeans went to around the world and went into South America and Africa and Europe and Asia, they brought diseases with them, like anthrax and syphilis and all these other things. And the very first point of call when people went to Southeast Asia was Banda Aceh on the very northern tip of Sumatra. And then you have like a 200-kilometer gap of pristine, very rich primary forests with no orangutans in them. And then you're connected to the Lothar ecosystem, which is full of orangutans. So the only explanation that makes any sense to me of why orangutans were not in this area before we started to introduce them there was disease. And it makes every sense to me that some disease was released into the human and great ape population in Banda Aceh and went into the wild primates and probably extirpated them for several hundred kilometers before it finally fizzled out. Nothing else makes any sense. Now, we also know that this virus is extremely contagious. Everybody on the news, all the humans and everything, it's like, viruses are viruses, but this one is super contagious. We know that orangutans scientifically should be susceptible to it. So we have to assume that it's not a case of if, but when they will get it. Now, our program is introducing new populations in the south of the island where they were extirpated by hunting, and in the north where they may well have been wiped out by disease in the last few hundred years sometime. Now, the question then is, what do you do about it? And so you have two options. We have to prepare for this. We have to assume that this is going to happen. Whether it's tomorrow, next week, next month, a year from now, we have to assume that the wild orangutan population is going to get impacted, and also the populations that we're trying to reintroduce. But the goal of the reintroduction populations is as a safety net population. Like I said before, I used to work for a guy called Gerald Durrell, whose whole vision in life was taking extremely vulnerable small populations, creating new ones somewhere else to act as a safety net should disaster befall the original wild population. Now, I never believed, I have always said that the reason we're doing this for the orangutans is just such a scenario. I never believed that I would actually be on the cusp of potentially having such a scenario in the next 6 months. But then the question is, what do you do about it? And I can see two options here. One is you either try to stop the spread, which I can't see is really an option for us. No matter what we do, we're not going to stop the spread of this disease once it gets into the population or whatever. We can try and minimize it, we won't stop it. And the only other option I can see is assuming it is going to spread, is to try and minimize deaths. And that means like massive amounts of investment in medical teams, trying to search the forest for sick and dying animals and rescue them and bring them into care and keep them alive. But this is what we're facing on a day-to-day basis, and we're having to actually address these issues and try and strategize and plan for these kind of scenarios. It's quite scary.
Thank you. I can see that Ian, Redmond and Johannes both have their hands up, but I've just got quite an interesting comment from the audience saying to Vernon about your data that you showed. It's really interesting that there seems to be parallels with humans, as in the males of the species seem to be affected worse by the respiratory disease. They didn't ask this, but I would like to know, can you think of any reasons why this might be?
Thanks. Yeah, I noticed that similarity myself. Yes, the only reason I can think of is that we have one X chromosomes, that's males have one X chromosome, whereas females have two. X chromosomes do contain programming for the immune system. And of course, females have to bear children who are going to have a different father and therefore different genes from the females themselves. I can imagine that females in chimpanzees, which also have two X chromosomes for the female, would have double the immunity of males. So that's my explanation, but it might not be right. It's the only one I can think of.
They were also wondering, with the death of the 4 high-ranking males in 2019, have you noticed that this has affected their social interactions and social dynamics of the groups?
Well, it's a nice question. I don't watch the chimps every day, so I might have missed something, and there may be an answer to that. But what I can say is that in the community, the Sonso community, which lost those males, there are now eight males only, compared to a much larger number of females. That in other words, it caused a big discrepancy between the number of males, adult males, and the number of adult females. It's had a big demographic impact, but I can't add anything to that, I'm afraid. That's all I know.
Thank you. I'll pass on to Ian Redmond now, because you've had your hand up for quite a long time.
Thank you, Iona. And just to respond to what Vernon was answering, in gorillas, if we saw a high mortality in adult males, silverbacks, that might well lead to the kind of social disruption that would lead to infanticide, in that it's in a number of, not every population, not every group, but in a number of groups, when a silverback male dies, if his females join another silverback, that new silverback is likely to kill a suckling infant in order to, well, the selfish gene hypothesis suggests that this is so that she quickly comes back into estrus and will spend the next 3 years bringing up his kids rather than the previous silverback's kids. So that gorillas certainly seem to be potentially more susceptible to the knock-on social ramifications of losing adult males. But I'm glad that Tothery and Singleton talked a little bit about the historical perspective, because I did want us and the audience to bear in mind that humans and the other great apes have been sympatric species, that is, living in the same habitat, since our evolutionary pathways diverged. So it's not new for potential pathogenic organisms to jump between species. And when we look back at the early field studies, George Schaller, who was the first scientist to spend any significant time observing mountain gorillas, although that was only 1 year, but in the 1950s, that was considered to be a long field study. Now we think a long field study is 50 years, but in 1959 and 60, when George Schaller made his observations that were written about in his book, The Year of the Gorilla, and his monograph, Mountain Gorilla Ecology and Behavior, he describes observing upper respiratory infections. He saw gorillas coughing and sneezing and having runny noses. And certainly when I got to the mountain gorilla research site Karisoki that Diane Fossey had started in 1967, I got there in 76. And there were some individuals with chronic complaints. They were coughing and sneezing a lot. There was a female called Pansy because you could always hear her coming because she was sort of panting and wheezing. So it seems that wild apes are prone to the same sort of diseases that humans are, and that in the past some sharing of pathogens was possible. But what changed when tourism began to be part of the picture was that apes were meeting people from all over the world at fairly close quarters. So before Diane habituated gorillas and other scientists habituated chimpanzees or orangutans or bonobos, the possibility for droplet infection, where you cough and sneeze and that directly infects an ape, was very, very unlikely. And then suddenly we've got a scenario from about 1979, 1980, that tourists are flying in from all over the world and getting to within coughing distance of a family of gorillas and then chimpanzees and then other apes. So that brought about new threats. And very sensibly, the conservation community drew up very strict rules of small parties of people, short observation period of 1 hour, minimum distance of 7 meters to try and minimize that risk. But that is an aspiration, not a daily fact. And in any 1 hour contact, the chances are a gorilla is quite likely to barge past the people and touch them. so that have that opportunity. And what makes COVID-19 more frightening than previous infectious respiratory complaints that humans might have carried to the apes is its ability, apparently, to survive as a viable virus for up to 3 days, depending on the surface it's on. So I just written an article for Travel Africa where I describe a scenario. You're walking up through the bamboo zone in the Virunga volcanoes as a tourist. You're not accustomed to the altitude, so you're puffing and blowing. And we've seen from a recent Dutch study, which was reported widely, that if you're running, then there is a plume of tiny particles of your breath with viruses potentially attached. So as you breathe heavily, you're creating a viral plume that will go in whatever direction the wind is blowing. And if the wind is blowing it towards the gorillas, even if you're staying at the regulation 7-meter distance, it might potentially infect them. But even worse, if you're coughing and spluttering and holding on to bamboo stems to support yourself as you go up through the bamboo zone, bamboo has a very hard, shiny surface. And that's the sort of surface which we are told the virus might live for up to 72 hours on. So you can easily see how a tourist who's just traveled on a plane or a bus to get there has picked up a virus from someone who didn't know they had it. They don't know they've got it, but they're shedding it, and it gets onto the hard surfaces that are in the forest and potentially infects a family of gorillas. I suspect the mortality rate would not be such that they would wipe out that family, but several individuals might die. And if we follow what Vernon was saying about it being adult males that are more susceptible, it might well be the silverback. So the females will leave that family to join another family, taking the virus with them and potentially losing their infants. And so that could quite easily spread through the population. And I don't think it would wipe them out, but when you've only got a little over 1,000 mountain gorillas left in the world, you really want to value every one. So I think that's why the COVID-19 disease is perhaps even more scary than the regular coughs and colds and potential for pneumonia, which we've been trying to take steps to prevent transmission to the gorillas and other apes for so long. This one brings in new potential threats. So I don't know if any of the other panelists want to chip in on that thought, but that the contagion that lasts for up to 3 days on the right surface in the habitat seems to me to bring in a new aspect to our precautions.
Vernon and Johannes both, and Ian Singleton all have their hands up.
Well, let me go first, as you mentioned my name first. I would like to ask Gladys about this, because Gladys has vastly more experience than any of us of gorillas, and I would like to know, Gladys, whether your chimpanzees, your gorillas, which have all daily contact with, not physical contact, but visual contact with human beings from all parts of the world, whether that has led to the sort of droplet contamination of the environment that Ian's described, whether you in fact have had problems with your gorillas.
Yes, the gorillas in Buindi in particular, thanks Vernon, the gorillas in Buindi in particular are some of the most visited great apes in the whole world. There's 18 gorilla groups and 8 tourists per gorilla group per day. So it can be as many as 40,000 tourists, between 30 to 40,000 in a year visiting them. So you can imagine they get a lot of visitors. And these visitors come from all over the world. And what we found is that whereas before the gorillas, at the very beginning, there were only 2 gorilla groups and 6 people per gorilla group per day. But now it's gone up to so many gorilla groups. And tourism has brought a lot of benefits. And so there's always pressure to habituate more and more gorilla groups. And tourism has really brought a lot of benefits. We find that the gorillas that have visited more are the ones that are growing. Actually, the ones that have had more tourism, the gorilla groups with more tourism are the ones that the populations are growing. So mountain gorillas happens to be the only subspecies that population is growing, and all the others that don't have tourism, it's not growing. Tourism doesn't have to be the only reason, but where there's tourism, so many other benefits come, such as regular monitoring, checking if they're sick, There's so many other benefits that come, but of course the money that goes to the community makes them really value these animals. And we have had, I mean, in Bwindi, there's been the respiratory diseases in Bwindi haven't been as severe, but in the Virungas, there's been a few gorillas that died of human metapneumovirus virus, which was traced to a strain in South Africa. Bwindi, we've had gorillas that have died of scabies. And of course, with COVID-19, we find that, you know, Ian mentioned the 7-meter distance. Unfortunately, it's broken quite a lot. And so this is something that we really have to do something about. And that led us to have some training in March 2020, when the COVID outbreak came out, because we were so concerned that as it was spreading at such a fast rate all over the world, we're very concerned that if it goes into the gorilla population or the chimps, it would be really, really difficult because we could lose them. This virus is very, very contagious. There have been other coronaviruses that have spread from people to great apes, like in Ivory Coast, to the chimpanzees. The chimpanzees had a mild infection, but they didn't die. But with COVID, it seems to be a much more severe form of a coronavirus, and we're very concerned about that.
One of our questions is, so what do you think are the physical, practical methods that we should be doing in places where people are interacting with gorillas, whether it's for research or in zoos or for tourism, to prevent the spread of coronavirus to the populations? So that would lead to...
Yes. Thank you. We recently, together with the conservation NGOs working with gorillas, who are on this slide, we worked with the Uganda Wildlife Authority. There is Martin Gorilla Vet Project, Gorilla Doctors, International Gorilla Conservation Program, Max Planck Institute. We also worked with the health centers, the Bwindi Community Hospital and the Ministry of Health, and we decided to hold this training. This was when Uganda had just got its first case of COVID. Actually, no, it hadn't yet got the first case of COVID, and it happened like a couple of days after we started this training. But of course, we were seeing it spreading all over the world, and we were very concerned. And so, you know, for those who have been lucky enough to go to Bwindi, this is how you start out the trek. You know, you get a briefing from the guide, and he talks about the 7-meter distance, which you can see over there. And of course, people are very excited as they're getting ready for the trek, and they listen to that. And this is how far 7 meters is from the gorillas. But if many of you have seen photographs of people with gorillas, they tend to be much closer than this. And these are tourists who actually were obeying the 7-meter rule, which is great. This picture was taken by Alison, who was a student who did some research together with us to see whether tourists are willing to wear masks and are willing to have more measures to prevent themselves making gorillas sick. And in 2014, another researcher called Annalisa from Ohio University and Dr. Nancy Stevens, together we quantified how many times gorillas break the rules or people break the rules, like Ian mentioned. And 60% of the time, we found that people broke the rules, and 40% of the time, gorillas broke the rules. Even if 98% of the time they were briefed before they begin that they shouldn't get closer than 7 meters. And so we decided to hold this training and review and enforce and upgrade the current regulations. And so some of them are ones that have always been there. If you're sick or you have a flu or cough, you shouldn't be allowed to go into the forest. Some people hide the signs, but after they've hiked up the very steep hill, the signs may become obvious and they won't be allowed to go. Because a lot of people have saved up and they're like, because they were asked, would you trek if you're sick? Some people honestly said, yes, I've saved up money, but majority said they wouldn't. And one thing we decided to add to the regulations was that people have to have their temperatures checked. This is a result of COVID. So we're measuring using a non-contact infrared thermometer. These thermometers became very common during the Ebola outbreaks in DRC, because that was the best way to tell whether somebody had a preclinical symptom of Ebola. And the very first case we had in Uganda did not have any respiratory symptoms. It was someone coming in from Dubai. All he had was a high temperature. So this is something that's being instituted at all the sites where the chimps and the gorillas are for trekking. And the hand washing has increased drastically, and people have to disinfect before they trek. So here we were training the park staff, and one of the main things that came up is mask wearing. And of course, the time that we went to do the training, there were no masks in the country. Even if you had money, you couldn't buy PPEs. Now they're becoming more available because people are giving donations, and a lot, it's improved. So we decided, what should we do? And we were able to get cloth masks made, which have the same protection, similar protection to surgical masks. And we got a local entrepreneur in the community, Right for a Woman, who normally makes crafts for tourists and tablecloths. We now got her to make cloth masks. And so she was upset that she had lost business, and the women she employs, she's gonna lay most of them off because no more tourists were coming. This was even before tourism was suspended. And then I said to her, can you make masks? So International Gorilla Conservation Program paid for that, and masks were made out of cloth. And then we were able to use them. And guess what happens when we go gorilla trekking? On top of, we maintain the 7-meter distance, we're very strict about it. But the interesting thing is that it rained so much that day that we ended up trekking during the rain, and the cloth masks were actually very good for that. Because even if it got wet, we could keep them on our faces. And I went trekking with the park staff as part of the training, and they all know that anybody who goes trekking has to wear a cloth mask, has to wear a mask of some kind, whether it's cloth or surgical. So in that group, we had park staff, one researcher, and we were able to go in and start this, and this is continuing during and after COVID. And so now we've given a donation of more infrared thermometers to the Wildlife Authority, and this is something they want to institute at all the tourism sites. So COVID has actually been an opportunity to upgrade the rules for viewing great apes in Uganda, and not only to prevent COVID, but any other respiratory disease. Vernon talked about the recent disease in Budongo. There have been diseases in the Virungas, Ian's talked about them, and it's going to help to protect the great apes from any respiratory disease. So that's probably a silver lining of COVID, is that everybody's taking it seriously, because the park staff don't want to get COVID from each other. The community doesn't want to get COVID. So this is one way that we're really working on it. But having talked about, I think maybe the last thing I'll mention is, we're not only concerned about the tourists, but the local community, because the wildlife is always going outside. The moment you habituate animals, especially great apes, they lose their fear of people, they're very curious, and they're going to go out a lot more. So the chimps go out a lot in Budongo and other places, and the gorillas go out a lot in Bwindi and other places. And so we have groups of Hugo, Human Gorilla Conflict Team, or Gorilla Guardians, who safely herd gorillas back when they come out. We are going to train them this week. And also village health and conservation teams who work in communities where gorillas come out. And we are improving on the hygiene, sanitation, and COVID prevention measures in these communities, with support from ACAS Foundation and Solidaridad Hope to create the posters. And we're also adding in one element. They had created just one on people, but we added something about gorillas down here. What do you do if you see a gorilla? Don't go closer than 10 meters, and the Hugos all have to wear masks, and call the Wildlife Authority or Hugos to safely herd them away. So nobody wants to make the gorillas sick, because they've benefited so much from them, from tourism. And it's very important that they don't pick up diseases from local communities when they come out. And sure enough, 2 gorilla groups have already come out since COVID came into Uganda, since we had that one outbreak. They've already gone to the communities. They don't know there's COVID, and they don't know about social distancing either. So it's really important to make sure that nothing happens to them. Thank you.
Good.
Johannes, you have your hand up still. If you'd like to say something, please do.
No, I wanted to go back to Joe's comment about the IUCN statement. And I think basically that statement made 3 main points. First is obviously the best protection is don't go and minimize the potential encounter with great apes. That's very clear. And obviously the situation is very different between Joe's field sites in the DRC, where they only do nest counts and camera trapping. It's very different from the mountain gorilla scenario, where we have 8 people per group coming on a daily basis. And as we have seen from Gladys, often even the 7 meters are not even respected. So that was number one recommendation: suspend tourism for the period of the crisis. Second, IUCN has best practice guidelines for tourism, and 7 meters are in. Wearing masks was already in long before we talked about that's an essential element of that best practice guidelines. There are also best practice guidelines on disease monitoring and disease control. And the third point the IUCN statement makes is basically, yes, we know there are a lot of great ape sites in the world, and they do entirely depend on tourism income. Some are lucky, they have third-party funding from donors, but some sites are really in trouble right now because they cannot even pay the salaries anymore. And that's a big issue because law enforcement operations are maybe not possible anymore. Field operations are not possible anymore. Sometimes just the presence in the forest, making sure that poaching is under control and encroachment. So the IUCN statements also encourage everybody, especially the donor community, to establish something for those sites. And I think that's something we might want to talk a bit more about. We really have to get money to the sites which are in danger right now. And it cannot wait for 6 months. It has to happen very soon. So these were the comments I wanted to make.
So because we've been talking a lot about tourism, this one, Vernon, do you want to speak?
Thank you. I just wanted to make the point that we don't have tourists at Budongo Conservation Field Station. So we won't be suffering from a loss of tourist income. Well, we have never had tourists as a matter of policy because of the danger of disease. I'm not sort of trying to be clever or anything, it's just a fact. Right from the very start, we made that policy decision. And of course, one can run a field site and make a success of it and study chimpanzees or apes, gorillas without tourists. I understand the reasons for tourism, and I wouldn't want to put anything in the way of the enormous amount of income and benefits to communities as well as companies and government departments that come from tourism, but it is possible not to have tourism. Thank you.
So that actually feeds very nicely. Oh, well, I've got hand up from Ian Singleton and Jim, but we'll go Ian Singleton first. If you'd like to.
Okay, thanks, Iona. I'll try and be brief, but I just wanted to put the Asian perspective on this. Tourism with great apes here is a completely different animal to tourism with great apes in Africa. There are no standards, there are no rules, there are large numbers of people going into areas to feeding platforms in extremely close proximity to orangutans, coughing, sneezing all over the place. There's no 7-meter guidelines, there's no precautions whatsoever, which is very scary. We consider ourselves in an emergency situation here. Indonesia is a country of like 17,000 islands, one of the highest biodiversities in the world after probably only Brazil, which is a single country and one landmass, much easier to manage than 17,000 different islands. We have the most endangered great ape in the world with less than 800 individuals. So compare that to the number of deaths on a daily basis in New York. They could all be wiped out in probably before midday. We have, you know, I really hope that this, and traditionally there's been very little discussion in Indonesia about these kind of issues. What I'm seeing in the last couple of weeks is that a lot more discussion about these issues. The government is engaging with the NGOs and the experts and the scientific community to try and discuss scenarios and possible remedies and things to do and implement. And I'm really happy to see that happening. But we're right at the cusp in Indonesia, especially, of potentially one of the worst COVID catastrophes on the planet. Indonesia is well known for its lack of medical infrastructure. Where literally today, the month of Ramadan has began, where people are moving out of Jakarta and out of the big cities to their villages. I just heard a story of a school that closed down, which has sent everybody home. It had like several thousand children in it. A few hundred have gone to Malaysia. 43 of those have tested positive already. None of the several thousand who've gone home in Indonesia have been tested at all. So we're right at the edge of a real potential meltdown in this country, and absolutely no rules and no regulations and no standards for tourism with great apes whatsoever. So I'm really happy to hear that African countries have got all these systems and procedures in place to deal with these things. But in Indonesia, we have absolutely nothing as far as from where I can see. But I'm extremely pleased to see that we're actually finally starting to discuss it and think about these issues. It's a bit behind times. Thank you very much.
So, Jim, would you like to speak?
Yeah, I just wanted to make a quick point about and tourism and people being in close proximity to great apes. Certainly, Gladys has shown that there's benefits, obviously, with tourism, and that applies to other places as well. And I think in the bigger picture, when we're talking about the risk of global pandemics, like what's happening right now, and also the risk of sort of human infection of great apes or other animals, it's what we need to be talking about is risk mitigation. So the stuff they're doing in Burundi is great, wearing masks and everything like that. But prior to just now, people weren't wearing masks. Hopefully that will change forever going forward. That goes also for, other great ape tourism sites, like in Mahale National Park, where I think they already have been wearing masks for a while, Gombe, all the other places around the world, and also the research sites as well. There needs to be better biosecurity, protecting the apes from the humans that are coming into close contact with them. So that's just the point. So you can have it, because the thing is the brown gorilla population probably wouldn't even be here right now if they hadn't started tourism back in the 80s. They probably already would be extinct. So like Gladys said, it's the only population that's still growing. And it took a really, really intense effort with tourism, with the gorilla doctors that started as the Mountain Gorilla Veterinary Project back in the 80s as well. It's like intense intervention of conservation intervention to save those gorillas. And now it supports all those communities around that area. So I think, there's always going to be a risk, whether it's a risk of people living around the parks and poaching. And if you have a presence of researchers or tourists in there, it helps protect the great apes. But we have to also take further steps to protect them further from people who want to see them and who are researching them and who want to protect them. We have to protect them further by doing the proper PPE and biosecurity methods to keep them safe.
That's great, thank you. So because of this links very nicely into the next question, which a lot of people have been asking different variants of. So do you think, I'm going to direct this towards Ian Redmond because he knows a lot about ape tourism. Do you think that stopping or limiting ape tourism might be a solution in terms of stopping them in the future from getting other diseases from humans? And if so, do you have any ideas for other income streams to help protect the apes?
Thank you, Iona. It is certainly a question that I'm involved in. Had you asked me 2 months ago what I was doing in a couple of weeks, I would have said, oh, I'm taking some generous donors who bid for a holiday to go and see gorillas at a fundraising event for the gorilla organization. So they would visit our projects, they would stay in lodges, they would visit the gorillas, and they'd come back as really well-informed ambassadors for gorilla conservation, having had that wonderful experience of being 7 meters from a family of gorillas. That's not happening, which means that not only is my bank balance hit, so is the bank balance of the lodges that they were going to stay in, so is the bank balance of the communities that grow the vegetables to sell to the lodges, so is the bank balance of the souvenir makers that Gladys mentioned, who derive an income from selling to tourists, and the rangers and guides, and of course the park fees and the gorilla viewing permits are not, that money is not coming in. So from that perspective, the COVID-19 has had a very negative effect, even before it's ever got to the apes themselves, because so much of our conservation thinking has, following the mountain gorilla model, been based on sustainable generation of revenues, but it's not sustainable if there's a war. And of course, some of the best gorilla viewing sites and other ape viewing sites are in countries which have been riven by conflict. And the tourism has pretty much dried up while there's been conflict. But because of the precautions that were taken, that it was only a small number of visitors and each one paying a relatively large amount, it proved to be quite resistant to that kind of problem, in that even soon after civil unrest or war ended, some tourists were prepared to go in. Even sometimes the people who work in the refugee camps to look after refugees displaced by war, when they eventually get a day off, what can they do locally is go and visit the apes. And I'm reminded that during the Rwandan refugee crisis in the mid-90s, we instituted foot dips for people who were coming from the refugee camps to visit apes, so that any dirt on their shoes were not was not carried into the park, with the potential for cholera and other diseases. So tourism has a huge negative, the virus is having a huge negative impact on tourism, and many of the things that we've started to think of as normal are not happening. I'm glad you asked about alternative revenue streams that might help. At the same time that tourism has dried up, a lot of donations to charities have died up. So I'm the trustee of several different charities, all of whom are seeing fundraising events cancelled. Although on Sunday there are a lot of activities for people to try and do fundraising events from home. You can climb the number of stairs in your house sufficient that you can climb Everest if you want to take a big challenge, and use that as a kind of self-isolating fundraising sponsored event. But in general, donations to charities, which have been supporting the governments of the Great Ape Range states for 30, 40 years, have declined. So we're struggling to keep our projects going. So if the charity sector is struggling and the tourism sector is struggling, what else? In the UK and in some of the other developed countries, governments have stepped in to offer businesses support. I haven't heard that happening much in Africa, because most African governments don't have the resources to do it. But the international community might well need to consider that to keep those businesses afloat until after the pandemic, they might need that sort of support. But in the longer term, the source of funding that I would most like to see helping ape habitat and the conservation of those apes is something along the lines of payment for ecosystem services, because the apes play a keystone role in the ecosystems in which they live. They are seed dispersal agents. They create light gaps in the canopy. They fertilize the soils of the forest with their droppings, and out of those droppings grow the trees of tomorrow. And as we all know, trees are really important in our efforts to prevent dangerous climate change. So I've been arguing for some years that these hashtag gardeners of the forest, the apes, the elephants, the other large mammals that eat seeds and disperse the seeds, are important. And when you look at the global weather maps of rainfall distribution, you can watch weather systems that build up over the Congo-Guinean rainforest, or the Amazon basin rainforest, or the Southeast Asian rainforest, moving around the world to water the fields where wine is grown in California or Spain or France or Australia or New Zealand or South Africa. And yet when you buy a bottle of wine, not a penny of the price goes to protect the forests that generate the rain systems that water the vineyards that grow the grapes that make the wine. So somehow we have to, when we recover from this pause button that nature has forced humans to press. We have to start thinking of how we can better design our economy so that the important ecosystems that make the biosphere habitable actually get out of our economy the necessary finances to protect them, and that every patch of forest or swamp or unpopulated area from a human point of view is not seen as a wasteland of no value until humans plow it up or drain it or cut down the trees and create some cash out of it, but actually has an ecological value that is essential. And it's really ironic that we're having this discussion right now, because in February, there was a meeting of the Convention on Migratory Species in India just before everyone started to close their borders and stop international travel. And that was supposed to be the kind of the curtain raiser of this year of 2020 of UN meetings that were going to reshape our relationship with nature. And in the UN speak, we are still all working towards what they call a post-2020 biodiversity framework, or other people have described as a new deal for nature. And the meetings that were supposed to happen at intervals through the year, the IUCN Congress, the CBD, Convention on Biodiversity meeting that China was supposed to host, and the climate talks, COP26, that Britain was supposed to host in Glasgow, have all been shunted into 2021. Because while we've been getting around to maybe thinking about how we might redesign a relationship with nature, nature has said, oi, humans, nature is still essentially in charge, and you need to really think about how you treat nature, and in particular the life support systems of our biosphere. And I wonder if I could throw that thought to Johannes, who is in a position to take part in some of these discussions on that broader policy of how, if international travel has to diminish because of the risk of disease transfer and the greenhouse gas emissions, what other mechanisms do you think might arise from these high-level talks that might actually practically help the families that live near ape habitat or other endangered species habitat that might be tied to the world valuing the ecosystem services provided by that habitat?
That's a pretty complex question, Ian.
It is. I have every faith in you, Johannes.
Yeah. I mean, it is quite unfortunate. I mean, this was really meant to be the super year for biodiversity. I mean, you mentioned it all: CMS, IUCN, CBD. I mean, very important meetings, and I mean, they're all trying ways that we value nature and also give us incentives that we protect and conserve nature. And I mean, it's a big issue. We see it in Africa, but we see it elsewhere. Every day we lose habitat, every day. And I mean, that leads directly to the discussion on tourism. And I think Jim said it very clearly. Whatever we do, there's always a risk. I mean, keeping tourists completely away is maybe better for the apes, but then we might lose the habitat because people have no other livelihoods. It's a very complex question. And yeah, it leads to a more complex discussion on economic incentives and payment for ecosystem services. Yes, we all need nature, we need the air we breathe, we need the water we drink, but often it comes from far away and we don't pay for it. And unfortunately, these UN meetings are not happening this year. It will be all next year. And maybe it's a wake-up call. It's hard to predict whether it makes governments a bit more responsive to the current crisis. But maybe there's something, and that's what I mentioned in my introductory talk, how we can feed the current crisis and hopefully some lessons learned into the way how we do development planning. I mean, we don't want to prevent countries from development. I think any country has a right to develop, but many things can be done better. And in an ideal scenario, there would be a strategic environmental impact assessment where you check what are the different options, what is the least detrimental to the environment, and then there are usually environmental impact assessments to mitigate the impact. But we never think about disease. We look into social environmental safeguards. We don't look into disease. But we all know, and there are many examples from South America, when people move deep into the forest and the indigenous people contract the diseases which were never seen there before. Same happened in Central Africa. So obviously, when we open remote landscapes for development and don't have precautionary measures, there's a high risk that basically new diseases migrate with the humans who follow the development route. But also the larger picture, when we change our climate, we change our biodiversity, we change our habitat. I mean, there's more and more evidence that a number of diseases were facilitated, or the spread was facilitated by environmental change. So maybe, and that's my hope, that virus crisis, hopefully it's also a wake-up call for governments to look into that specific angle and to find new solutions, how we value nature, and somehow economically incentivize the protection and conservation of nature. Does it answer your question?
Well, Gladys has her hand up for, she's got something to say. So would you like to chip in, Gladys?
I'd like to chip in and say that COVID has been a wake-up call to make us realize that tourism we can't only rely on tourism as sustainable financing for conservation. It's been a big wake-up call. Because I mean, in the past, we've had like Ebola outbreaks in Africa, and even if it's in Liberia, we may have a reduction in tourists to Uganda or Madagascar or any of these other countries, but it doesn't go away completely. But this time around with COVID, even before it's got in the communities or anything around where the great apes are found, people can't fly in anymore. The tourists can't come from other countries, and there's been no tourism at all. And so this has been a real wake-up call. And I would like to say that we started a social enterprise called Gorilla Conservation Coffee, working with farmers around the park, giving them a better price to reduce their need to enter the park to poach. And I'm happy to say that during this COVID pandemic, we're able to still buy coffee from the farmers, because we are getting orders from like UK and America for people who want coffee. And cargo planes are still flying, so we are still able to support these communities in the absence of tourism. And we need to look at other kinds of businesses like that that are not solely dependent on tourism. Yes, the sales have gone down, of course, because a lot of the tourists buy this coffee, but in the absence of tourism, people in other countries, Europe, America, Japan and countries like that, Australia, can still continue to support conservation without actually visiting the animals in such a way as, Gorilla Conservation Coffee. So that's at least one thing that's continuing, and we're pleased about, but we need to have many more businesses like that are not solely dependent on tourism in order to survive. So as long as the communities are having some income, they need to reduce their need to enter the forest to want to poach.
And thank you for that. Vernon also has something to say, if you'd like to speak, Vernon.
Yes, thank you. This has been following this with great interest. It's a question of tourism or no tourism. It links up with something that came up at the African Primatological Society meeting in September in Entebbe. And that is something dear to my heart, actually, and that is that I think it's for the indigenous countries, the range states, as we call them, the countries where these primates live, that to find ways of developing support for primate projects, which they don't have at the moment. And I'm sorry that we have to rely on tourists to support gorillas in Bwindi. I wish we could support gorillas in Bwindi without tourists. Yeah. We are managing, with the help of zoos, as something that I wanted to mention, zoos, but they're zoos in Europe, and in our case at Wodonga, it's Edinburgh Zoo, Royal Zoological Society of Scotland, which supports our work at Wodonga, and Oakland Zoo in California, which supports our work in Wodonga. So zoos can have a very big part to play in providing funding, core funding, it won't be huge funding, and they don't necessarily need to come and visit. They might occasionally send a group of people to come and visit, but they're not going to swamp your gorillas in the way that that tourists do. But of course, tourism is a fact of life. I just wish it wasn't, and I would like to find ways that funds could not even come from America and European zoos. That funds could be generated in Africa for African primates and in Indonesia for Indonesian primates. It's such a long way in the future that most people don't even think of it, but that's the way forward, surely. Those funds should come into the local communities through the mechanisms in these societies. There are district environment offices, and there are district environment officers whose job it is to protect the environment and whose job it is to protect the forests and the wild. You are in Uganda, the Uganda Wildlife Authority. Every country has an organization, usually attached to government, which is responsible for the animals in that country. These are the people in the end who are going to save the apes. It isn't in the end going to be us at all. However much money we throw at it, it's not going to be us, it's going to be them. And I wish there was some way, and I simply don't know what it is, some way of galvanizing governments in range-straight countries so that they see the value of their wildlife and protect it and preserve it themselves. I would like to see that happen, and I'm not happy with the way that the money comes from other countries and from overseas.
So a lot of people would like to respond to that, but Johannes, you were first, so would you like to go?
Yes, and I'm partly agree with Vern, and partly don't agree or disagree. But obviously, I think we need a short-term solution. I mean, and providing emergency in a difficult situation. I think that's really important, and I want to repeat what I said before. And we need a short-term solution. And I think in the long term, I mean, there have to be ways that that conservation of species and habitat is an economically viable land use option. And there are different ways. Tourism is one. There are other opportunities. I mean, I was sometimes thinking, obviously, the international community has pretty much accepted that we have to pay for the climate and we pay for carbon credits. Yes, it's somehow we pay for our sins because we also pollute, but it does bring money also to the developing countries and to have sustainable projects. But we don't have wildlife credits. Why? And I mean, Vernon was questioning, why does the money need to come from the north? Well, it doesn't need to be, but that's where a lot of money is. I think it's not a crime if the rich north, and I exaggerate a little bit, but I mean, I think gorillas and orang-utans and bonobos and chimpanzees, it's a global asset. So I think we all should contribute. And if money for conservation comes from the north via wildlife credits or anything else, I think it's a good thing and we should promote it. And then maybe something where Ian can step in. Yes, we have to be creative. We have to find new ways. Now the tourists cannot come, but there's virtual tourism, and Ian has been very active on the front. There's also augmented reality games, and I was very impressed to see that a small company based in Kenya called Internet of Elephants launched Wilderverse a few weeks ago, which is an augmented reality game at the moment with chimpanzees and orang-utans. But it also meant to educate and in the long term create attention and engagement for the conservation of those species. So I think we have to be creative. Thank you.
So Johannes passed on to Ian Redmond, if you'd like to.
Thank you. Thank you, Johannes. I was going to come in and talk about ways that people can have a positive experience that they might like so much they're prepared to pay for it without leaving home. And that is partly, as you mentioned, virtual travel, which is possible these days. And I have been involved in a small team setting up a thing called VECOtourism, V for virtual ecotourism.org. And our VECO Tours app is at the moment free. And if you download it, you can play with it with your phone in a VR headset or without a VR headset, just hold the phone in your hand and get some sense of what it's like to be in a rainforest, listening to the sounds, put the earphones in so that you block out your ambient sound at home and put the headset on and you are virtually in the forest, which is really exciting. But that's not at the moment tied to any revenue either for Vicotourism, which was set up by an American philanthropist called Mark Laxer, or to help the projects, other than at the end of some of the tours, you might be invited to help the organization whose project you've just visited. So virtual travel has that potential of generating money because it's a fun experience that people are prepared to pay for, and that a proportion of that money that they pay should go to protect the habitat, and whether that's done through a charity or whether it's done by, I mean, Rwanda is I think about to launch something similar for visiting mountain gorillas. We can't at the moment live stream video from the gorillas themselves, so it'd have to be kind of at the end of each day, the ranger that had the GoPro tied to his chest and the 360 camera on his head would download it, and people would pay to experience what was seen that day, and that would generate a new revenue stream that had much less of a carbon footprint. There's obviously some carbon footprint in running servers and internet equipment, but much less than flying around the world and being a physical tourist, being a virtual tourism. But then you might want a souvenir. So picking up on what Gladys was saying about coffee growers still being able to fly freight out of Uganda, and therefore communities around the gorilla habitat benefit, how about the people who make the souvenirs continue to make them, but they are marketed in the same way? So people who have visited virtually can buy a real souvenir from that community, and that money goes direct to them. And the shipment is well, get one of the big international shipping agents to jump on board and help with that. And even the musicians and dancers who perform for the visiting tourists. How wonderful it would be if we use this technology that we've got right here, Zoom or some other sharing technology, to have a concert from one of the lodges, which is perhaps very almost empty of tourists, but the dancers and the musicians could perform for a global audience who would actually pay, unlike everyone who has joined us today. I'm delighted you're joining us for free, but consider, would you be prepared to pay a small amount? And if there's thousands or tens of thousands of you, that would actually be quite a large amount, to put money in the pocket of communities that have been hit by tourism. That could be organized next week. Doesn't need a long-term thing. Let's organize a sort of a concert of people living in and around ape habitat, presenting their traditional dance and music to a global audience of people who care about apes and the people who live around those apes, who would then contribute for however long they watch the concert. That could almost immediately bring money into the pockets of people who might otherwise be tempted to go into the forest and cut wood, make charcoal, poach animals, just to feed their kids and to get by. And I think with a little bit of energy and enthusiasm, this community of people watching this can do it. We are the Ape Alliance. We are allies for apes and the people in whose hands the future of apes is held. So let's use the modern technology that we have available for virtual travel, virtual concerts of traditional music, and souvenirs, as well as coffee and perhaps tea and other crops that are grown organically around the park. I know the Gorilla Organization has been training people who used to poach in Bwindi to grow organic vegetables. Well, they can't sell them direct to lodges now because there aren't enough tourists in the lodges, but let's help them develop pickling plants so they can sell pickled vegetables, organic, around the world using the same freight that Gladys has pioneered with her coffee. We just have to use our imagination and make it happen, but not vaguely sometime in the future. We can do that now. We have the technology, we have the enthusiasm, we have the contacts within this group. We can do that.
Well, we've had just had a great comment on the Facebook live stream saying they'd love to see a wildlife relief night similar to how Comic Relief raises money. So you could have, that would be really cool. So Joe would like to say something to do with this, if you would still like to say it. And then
I do. Actually, I've been making notes and I have a lot of things in my head. So I'm just gonna rapid fire at you. So, first of all, this is an extraordinary event that we are living through together. We will come out of it, but this has violently, in some regards, exposed our vulnerabilities. So I have had all these thoughts. Ian, and I appreciate the concept of the virtual travel and stuff, but one of the things that I see happening in the United States is this disconnection from nature, because people can watch it on TV. I could tell a story about one time I was in Johannesburg airport waiting in line, and there was this group of American tourists who were outrageously obnoxious. And I stood there with just my little backpack. I'd been in the forest for 18 months, and all I had coming out of the Congo was a little backpack. And these obnoxious tourists started talking to me and asking me, I hope I'm not offending anyone, but asking me what I did. And when I told them what I did, their concept of what I did was so not real. And the things that we lose when we have a general population that's disconnected from nature. Okay, that's one thought. And Jim, maybe you can address this topic a little bit, but I believe with PASA, do they not require a financial plan that includes reserves in case of emergencies? You can maybe speak to that. Another thought, partners in conservation. I know Gladys, Ian, Vernon, Johannes, you probably are familiar with Partners in Conservation. It's an organization that is under the umbrella of the Columbus Zoo, but they do a lot of this, having souvenirs, and they have fetes every year, fetes, where people here in the States go to these fetes, donate lots of money, buy these little souvenir trinkets, and they don't necessarily go, in fact, most of them probably don't go to see the gorillas. They are just donating through Partners in Conservation. Something that we are doing, and Gladys, this kind of triggers off of your talking about tea and coffee, is part of what seems very obvious to me is that this current pandemic is related to globalization. And what I'm aware of is because food chains and economic chains are cut. So Ian, do you remember, and Vernon, you probably remember, when I first went to Zaire, before it was the Congo, I had those little gorilla soaps. Do you remember those little gorilla soaps that some, yeah, Vernon, do you remember that some hotel was making that? Do you remember those little green gorilla soaps? Okay, so what we've been talking about with my group is there are many local, regional soap manufacturers in the Congo. And coming out of this, trying to form some kind of a collaboration where we have them make soaps that have bonobos on them, or elephants or leopards or whatever. Because one of the things that I am blatantly aware of is soap and potable water. When you're reaching these communities that are out there, soap and potable water are not easily had. And so having a relationship, you can see, I've been sitting here keeping quiet, dying. Okay, so having a, yeah, everybody knows me, they're going, yeah. Having this local relationship with soap manufacturers so that when in the future, if things are shut down, everything is not cut off. I mean, we've gone through this in wars repeatedly where things are stopped, but it didn't affect the human population as far as the ICCN guards continued to go out and stuff like that. So I don't know, those are just some of my ideas. I've got something to shoot out there at everybody. Go for it. Discuss.
Well, Jim, you've got your hand raised, so if you'd like to go next.
I just wanted to answer Joe's question about PASA and the accreditation through PASA, or there's also GFAS, which is the Global Federation of Sanctuaries. And yes, part of the accreditation is you have to show sustainability and a long-term plan for how the sanctuary, will stay functioning. Something that we do at Liberia Chimpanzee Rescue and Protection, we're pretty new, but we're already thinking about a succession plan for when we're not here anymore, and then also right from the beginning starting an endowment, because an endowment can be built for any conservation project. And setting aside a little bit of money from donations that you're getting, at whether it's a research project or a tourism or some other conservation project, that can help you sustain organizations through difficult times like this. And I think all these great ideas that everyone has on this panel in terms of like raising money, part of it also is diversifying your sort of revenue stream. I think a great way, certainly social media has really changed the way people can raise money. And so taking advantage of that, building your exposure so you're exposed to more people, and having your messaging clear and what your needs are, I think can help people to help people and organizations raise money to help them get through tough times like this. Because I think Joe made a really good point about the fact that what's happening right now is unprecedented for all of us. I mean, no one has lived through something like this. And so what I keep hoping will happen is that, I think a lot of people are already, especially the younger generation, is obviously very concerned about climate change. And there's certain segments of certain populations that don't think it's a problem. That's a small population, fortunately. But this climate change and this pandemic are both symptoms of the bigger problem. And the bigger problem is human behavior and humans' relationship with nature. And so I hope what happens after this is that people globally, all of us, reassess our relationship with nature, with animals, and figure out a way to, have our economies and our economies and capitalism itself just be more responsible of how we interact with nature and with the planet, because there's only one planet. And so we have to do something so that we keep ourselves healthy and the animals healthy and ecosystems healthy. And that's a whole new paradigm. It's a whole nother conversation, but it's a whole new paradigm in public health called One Health. So I think this what's happening right now, everyone's experiencing it at the same time. And so we're all going through it together on some level. And I hope that it will open up a much larger conversation about how we go forward as a species and how we interact with the planet as a whole.
We haven't mentioned the wildlife trade that much, and that's something that's been in the media a lot, to do with the wildlife markets in China. So someone has asked, is the greater control of the wildlife trade the key to preventing future pandemics of zoonotic diseases, or will they continue as long as human development impinges on habitats? So I'd like to direct this question towards Jim to start with.
Thank you. So I think I said at some point during this conversation, I was saying that certainly, so human behavior is the problem. And there's different ways that humans interact with the natural world. And whenever there's a spillover event like this one, these events where there's zoonotic diseases going from humans, from animals into humans, whether it's domestic animal or wild animal, they've been happening throughout history. So as we started to domesticate animals, there was diseases that went from domestic animals into humans. And now what's happening is that humans are, our population is growing. We're encroaching more and more on these wild, on the habitats of wild animals. And the places where that's happening, where there's a higher level of biodiversity and there's high levels of human population, and people are doing things like mining or extractive industries or agribusiness. So there's habitat destruction that's happening, which disperses animals. It makes them, they're stressed out, they're moving to different places. That's one way that the diseases get from animals into humans, because their habitats are disturbed. And then the other way is more direct contact with the wild, with markets, whether it's markets or hunting. So certainly in China and parts of Southeast Asia, I think there's a higher risk. It's part of it's a cultural thing. So like here in West Africa, in Liberia, like I was saying before, people do a lot of hunting. They have bush meat. People eat bush meat, but there aren't live markets, right? So the people who are most at risk, there's an interface where the hunter goes into the forest. He comes into contact with a wild animal. Maybe he butchers the animal, maybe he doesn't. Maybe that goes to another person. There's sort of a value chain where there's certain people involved in that value chain that are at a very, very high risk of coming into contact with a zoonotic disease. And then someone might get infected. Over the course of history, that's happened probably thousands, maybe millions. We don't know how many times that's happened. In China, where it's more industrialized and people farm a lot of wild animals, but they also source them from the wild to supplement their farm that they're having. And then the animals go to these markets, these wet markets. People know the term wet market nowadays, which they maybe didn't know before. There's animals that are very stressed, and they're in a new environment and they're alive and they're maybe shedding virus. So I think there's different ways. If we completely ban, wet markets or wildlife markets or the sale of wildlife in general as food, of course, it goes back to the risk mitigation thing. It will reduce the risk of zoonotic diseases getting into the human population, but it would not eliminate it entirely, because there's other things that people do that can also increase the risk of people getting these diseases. So I'll give two examples. Nipah virus, which emerged in the late 90s in Malaysia, was from bats that were shedding virus into a pig farm, and then the pigs were getting sick and they gave it to the people. Okay, so the pigs were the amplification host. And then the Ebola virus outbreak that happened in West Africa, so in Liberia, Sierra Leone, and Guinea, it's thought that one bat came in contact with a little boy who was the first index case, and then he spread it around. So there's different ways that zoonotic diseases go from from wildlife into human beings and cause these global pandemics. And so again, it goes back to ways that we can reduce the risk of that happening, and that goes back to human behavior. Whatever human behavior you want to talk about, whether it's people reducing the hunting or reducing wildlife markets or reducing destruction of habitat where wild animals live, where there's a high level of biodiversity. If we protect those areas, it will reduce the risk of those diseases getting into the human population.
So Joe, you have something to add?
Yes, I do. And yeah, I agree. I appreciate what you said, Jim. My thoughts very quickly are that COVID-19, this pandemic, is density dependent. It's density dependent both in the fact that it happens in particularly urban markets, at commercial live animal markets. Wet markets are not the problem is. Wet markets are farmers markets where they hose down the vegetables. So wet markets is really a misleading term. These are live animal markets. And pandemics, and Jim, correct me if I'm wrong, but pandemics are density dependent. And one of the reasons that this particular pandemic is so pervasive is that it is extremely efficient in transmission. It has asymptomatic contagion, so people can have it and don't even know it. It has pre-symptomatic contagion, and so you have to think about what COVID-19 is shutting down animal markets is not the answer. And I'm sorry if that offends anybody, but it's the commercial markets. There are forest dependent people. If you ride along a trail on a bicycle through the Lukuru area landscape, you'll see a little a guy with a little couple of sticks put together where he's got a platform and he's got some dried meat out there. That's a market. He's selling his dried meat. That's subsistence income. So I think we need to focus on commercialism. We need to focus on density dependent avenues of transmission if we're going to talk about pandemics. Thank you.
So would like to speak, Ian Redmond. So do you want to jump in, Ian?
Thank you. I was just wanting to thank Joe for stressing the difference between wet markets, which are essentially farmers markets, and wildlife markets. And I would just add, there is a petition that was originally a letter that was sent to the World Health Organization by 241, and now it's gone up to a second version, has now got the support of another 100 organizations, so about 350 organizations around the world, urging the World Health Organization to advise governments to close wildlife markets. And the last two paragraphs of that letter stress that this is the large-scale commercial trade that they're talking about, not subsistence hunting and eating, and certainly not where people have no alternative income, but that those people should be given help to transition away from dependence on eating wildlife, simply because, as Jim very eloquently put it, we're trying to reduce risk. And everywhere there's an opportunity for a virus to jump species, we need to look at that opportunity and say, how can we minimize the risk? And closing big commercial wildlife markets is one, stopping tourists from coming too close to gorillas or chimpanzees or other apes is another, but that opportunity has always existed. And as has been pointed out, it's happened before, it will happen again. And it's almost a case that a sublethal dose of a virus where the animal survives improves its chances in future. So the worst thing is a new virus in a naive population which has no resistance at all to it. So we're trying to prevent a lethal infection, but bear in mind that these viruses will continue to mutate and circulate, and it's actually better for us all if we have resistance to it, some immunity to it, because we've had exposure to it and our immune systems have kicked in. So we've got a lot of factors to weigh in this balance. Thank you. I wasn't expecting to get the floor at that point.
Johannes has asked to speak, so go on, Johannes.
I just wanted to comment what Ian was saying. I mean, the whole issue with wildlife market is obviously very complex, and there's obviously a health argument, and then Jim explained that very clearly. There's a legality element. I mean, a lot of markets are illegal, and they're trading. We don't want this. There's a sustainability issue as well. You can have legal markets, but you can also have illegal markets, and both can be sustainable or unsustainable. When we talk about fisheries, often it's legal, but unsustainable. We talked about local people, indigenous people, where it's important animal protein. Obviously, we don't want to ban this. There's also an ethical, cultural element in here. I mean, we consume species in the north, and we might not want to consume certain species, but other parts of the world consider this absolutely ethical, appropriate to consume the same species. So there's an ethical, cultural element, and obviously an economic element. And I think even the term commercial needs a bit more of definition, or at least we need to talk about the scope. So is game farming, is that it's commercial? Is that also what you want to ban? Even if game farming is done by local communities and it's an additional way of creating income, as in many cases in Southern Africa. There is a wildlife economy, including consumptive use, which is an important element in Southern Africa. So what do we mean by commercial, and what do we include and what do we not include? So I think when we put out such a petition, we need to be very clear, what do we mean by commercial markets, and what are the reasons why we want to ban it? Is it a food and safety reason? Is it an issue of legality, an issue of sustainability, an issue of cultural reasons, economic reasons, etc.? Thank you.
Joe, would you like to follow on from that?
Johannes, my thought on your comment, and I agree with you, is how do we balance policy implementation with driving illegal trade underground?
I mean, law enforcement obviously is an important element of this. Maybe I can just cite the Jeff-funded FAO, WCS, and Partners project on sustainable wild meat in Central Africa, which is, I mean, we know that wild meat hunting, bush meat hunting has been there for a long time. It has been part of the culture, but unfortunately, in many cases, it's not sustainable, and in many cases, it has become commercial because the buyers are not in the villages anymore. The buyers are in the big capital cities, and they have some money, and it has become part of the lifestyle. So that's a way, hopefully, where local trade can be permitted, but it will be controlled, accompanied by law enforcement. So there are incentives, but there's also punishment if the regulations are undermined. And I'm very curious to see whether it will lead to more sustainability. That's what we all hope.
As we've been talking about the wildlife trade and bushmeat eating wild animals, people were wondering, is stopping of eating wild animals, is that enough? Is that different to if we're continuing to eat commercially farmed animals, so domesticated animals, is that almost as big a risk to future pandemics as it is of eating wild animals?
I would say that it's not as big a risk because wild animals are normally supposed to be out there in their natural habitat. And the reason why we're eating them is because we've entered their natural habitat. And so there's a lot more room and scope for spread of new and novel viruses and emerging diseases coming up. I mean, goats have been, for example, goats have been domesticated for centuries, so have cows, so have chickens, and we've taken them out of their natural environment and they're actually now domestic animals. Now, if you go out there and say, now I'm going to go for a pangolin or a bat or something that lives in the wild, and now you say you're going to eat it, the chances of getting something new that you're not used to is much higher, especially that's through hunting. You know, for example, the case of Ebola that was mentioned earlier, you know, most likely, we don't know if it was a bat, but something in the forest resulted in gorillas and chimps dying of Ebola. And the hunter who went out to hunt these animals ended up dying of Ebola. So did all his family and everyone else who came into contact with this meat. Same thing with anthrax and hippos. You know, hippos are in their natural habitat. They die of anthrax. Someone eats that meat. Some people die of anthrax. You know, so it's that whole thing of being really invasive in a habitat where you're not supposed to be is what is more of the bigger problem. But commercial farming, you know, that domestic farms have always been around. I have to say they've always been around. Although one thing I can say is that when animals are in very bad conditions, like I know it's reduced drastically, but for example, when I did my vet training in the UK, you could go on a pig farm and it's so horrible. Like the pigs are inside a fat house, they don't see light, and they're only supposed to get fat to be eaten, to be made into bacon or sausage. Those kind of conditions don't help either. Animals get very stressed. And those conditions are also not good. So more organic, more like animals are farmed in a way that's more friendly, environmentally friendly. They have a better quality of life. Is going to result in less emerging epidemics and pandemics. So the way that we treat animals, we have to respect them much more, whether we're farming them for consumption or animals in the wild that we're not supposed to just enter into their habitat and destroy it, and or have negative interactions with them. All of that is going to really make a big difference to whether or not we're going to keep having occurring pandemics like COVID-19.
Because didn't swine flu come from commercial pig farming?
Yes, it did. It did come from commercial pig farming. And pigs do get, you know, like African swine fever is a well-known virus that happens in domestic pigs. But the case when it starts to jump to people is when everything gets too much. And that's the case a lot in some of these markets around the world. I have to say that in Africa, it's much less of an issue than it is like in a place like Wuhan, where, you know, those live markets have animals which are alive in very tiny cages, very stressful conditions. That's much worse than, you know, like the markets that Joe was talking about that you find in Africa, you know, on the roadside, you know, subsistence markets that people have been doing for centuries. That's different from that very commercialized situation you get in some places, some markets like in Wuhan. But maybe Jim could add a little bit on that, on the swine flu.
A lot of people are asking to speak. So Vernon was first, if you'd like to say something.
Yes, thank you. It's just a quick comment on this question of wildlife markets and bushmeat trade. We do have it in Badongo, and it's on the small scale. Is what it's not like the big markets in Asia and elsewhere. It's what we've done. We've offered hunters who go into the forest to get animals for sale along the roadside. We've offered them goats in exchange for giving up hunting. We've been doing this for some years, and it's been quite successful. The goats are looked after by our vet, so they are clean. The wildlife, of course, may not be. So one way of dealing with this on a small scale is to offer alternatives to the hunters. In exchange for giving up one kind of meat, they get another kind of meat. It's unfair to ask them to give up meat altogether. So I just mentioned that. Whether that's applicable on a wider scale for these big markets, I have no idea, but it works on a small scale. Thanks.
Thank you. Joe, would you like to chip in?
Two thoughts. First, bats cannot give you COVID-19. Bats cannot give you COVID-19. Okay, so my second thought is, because we've tried fish ponds and things like that, and in forest-dependent populations, you have to remember a lot of the time that when you introduce new alternative food sources, they really become supplemental food sources. So getting somebody to give up a traditional food source, well, is practically impossible. Okay, thank you.
Thank you. Jim, would you like to say something?
Yeah, I just wanted to make a couple points. Earlier when I was talking about wet markets and wildlife markets, I should have been more specific. What I was really talking about was sort of the industrial or commercial markets. Just like Joe said, just like everyone has been saying here, a lot of people, if someone lives out near the forest and they have been, I mean, people hunt all over the world. It's almost human nature to hunt. So people who rely on the forest for protein, of course, that's not the problem. The problem is what someone else mentioned, is that it's the scale of the commercial stuff, where there's people in the big cities who are paying hunters to go out and essentially harvest lots of animals and then bring them to these markets in the cities where they're then sold. And so that's the problem. So there's a disease risk interface problem going on there on multiple levels through the value chain. But there's also the problem that is destroying the balance of the ecosystem because you're over harvesting animals. And then the other thing is what Gladys was talking about is, I don't think we're talking, like in Uganda, there's not big industrial agriculture, but in the United States, there's industrial agriculture. In other parts of the world, there's industrial agriculture. And it's not only horrible for the animals from an animal welfare perspective, but it's another source of potential disease. The animals are stressed. The African swine, there's just a huge, it wasn't really much in the news because African swine fever is not a zoonotic disease, but it was global in scope. I mean, China lost millions and millions of animals to African swine fever. It was spreading. It might still be spreading, actually. I'm not sure. But it was a major outbreak that was spreading around the globe. And so, again, I think it goes back to human beings deciding or making a commitment to change their behavior, whether that's the way we interact with, whether it's reducing hunting or eating less meat or changing the way we do, business, really, where instead of just thinking about, well, we need to get this copper out of this place and we'll do whatever we can do to get it, you have to be more responsible about it. Humans need to be more responsible about how we treat animals, about how we treat the environment, about how we treat ecosystems. And hopefully this is, like everyone said on this call, hopefully this is a wake-up call that people actually wake up and say, we need to change the way we're doing things.
Thank you. So we've got another audience question for Ian Singleton. They're just wondering about your opinion on wet markets or wildlife markets in Asia, and if you've got anything to weigh in about what the other panelists have been talking about.
Yeah, I think Vernon mentioned that his experience of markets on the roadside in Africa is not the same as what we have in Asia. And I mean, I personally try and avoid the animal markets in Asia for my own personal health reasons, but they are vast. And you're talking about thousands and thousands of animals and hundreds of people working there on a daily basis, whose health is exposed to all sorts of God knows what. And then all the dead animals and all the waste is thrown in the ditch, and it goes into the local community and surroundings. So it's not just affecting all the people that work in these markets, it's affecting all the people who live around them. And it's all the people who have offices and work environments within a kilometer radius of these markets. And I've always wanted to get medical students in to do studies of, like the sort of infestations of parasites and infections with distance from the market. And I'm sure you'd get a lovely pyramid graph. And I think we're really failing in our attempts to try and stop these markets by just focusing on the impacts on the wildlife. I think our biggest asset is focusing on the impacts they have on the health of the people that work in them and are forced to live around them. And if we could get that across, we'd actually have a massive ally on our side. These people would want that market closed down because it's impacting the health of their families and their kids and the school and everything else. And I think we're missing an opportunity there. But they are horrible, horrible places. Indonesia is very famous for its love of keeping songbirds. And songbirds are captured by their millions on a daily or weekly basis. A tiny fraction of those animals end up actually in the market because 90% of them die in transit. And then 90% of the ones that make it will die before they are sold. It's just a massive drain on immense populations of wildlife. It makes no sense. They're all illegal. It's really impacting the health of everybody who works in them and everybody who lives around them. It then comes down to a question of governance. And the problem is that the wildlife trade is like one of the, I mean, I'm no expert on this, but it's one of the biggest revenue generators for the black market after the arms race and the drugs. Maybe it's even higher than one of those. So you're talking about really, really big players. And that's the problem. The government may want to do this, may want to deal with these, but when you're talking about players that are bigger than governments, the kind of people who actually decide who becomes the next president, who becomes the governor, that's where it all falls down.
Thank you. That actually goes very nicely into our next question, asking, is there likely to be a positive impact from this current situation on sort of ape populations and nature in general, in terms of leading to regulations being taken more seriously, meaning there's a reduction in bushmeat consumption or reduction in the pet trade. Ian, I see you've put your hand up.
Yeah, I would love to be, I'll keep it short, but I would love to be the first person to answer that. But I appreciate, and I've watched for many years, how way more advanced a lot of the African countries are in terms of taking these disease risks and other issues seriously. Asia is a long way behind, and it's never going to be proactively changing its behavior. But I'm seeing this COVID virus as an opportunity. There's a lot of discussion going on now with the academics and the government about how to address this issue and how to set in procedures and protocols to deal with it. And I've never seen that before, so I'm quite optimistic on that. But what worries me most is that for this to be effective, these animals have to survive this. And we're talking about, Sumatran orangutans, one of the most endangered great apes in the world, 13,000 or so left. But we're also talking about Tapanuli orangutans with less than 800 individuals. And they are already in 3 subpopulations. The biggest is only around 570 or so, we think. And the estimates of what makes a viable population is around 500. So we only need to lose sort of 71 of those animals before that population becomes non-viable anymore. So we really are looking at this pandemic as a threat and a risk of actually losing a species from the face of the earth. And you may think I'm sort of over dramatizing. I'm looking again at people like Joe and other people who've got a lot of experience of Ebola, and we've seen Ebola before. The animals are still there, but they're in different subpopulations, whereas all the Sumatran orangutans are pretty much in the Losar ecosystem in one big block. All the Tapanuli orangutans are in the Batang Toru ecosystem in one big block. All we need is an infestation to get into one of those blocks and spread wild, and we could easily lose one of those species from the face of the earth in the next 24 months. And this is what we're actually trying to plan and deal with right now.
Joe, would you like to chip in?
The question was something about silver lining or positives, is that right?
Yes.
Okay, so I for those of us who've been around a little bit longer, when HIV in the 80s, the early 80s, what happened when HIV became a pandemic is society changed. Those of us who were sexually active before HIV would not have ever used a condom. But people use condoms now. Society changes. So I see this pandemic as a trigger to change society, whether that means enforcing mask wearing, social distancing, stopping shaking hands, things like that. Those are positives that will help our global public health, that are societal changes that come with this kind of a pandemic.
Thank you. Vernon, would you like to speak?
Well, I think we've begun talking about cultural differences now, and especially differences between Asia and Africa. And those are going to be way beyond anything we can change in either a little discussion group or probably in 100 years. Culture changes very slowly. Maybe this will be a trigger to some change, in which case good. And if there's a silver lining, the silver lining I would like to see in Africa, which is the only area I know about really, is I would like to see more devolved decision-making by local authorities to keep people out of forests and keep wildlife safe. Local authorities are charged with doing that, but very often people who transgress the laws in Uganda, for example, get off with a very light sentence or a very light fine, which is easily paid because magistrates don't have sufficient don't feel strongly enough about. They don't feel nearly as strongly as we do. Now, maybe COVID will change that. If COVID impacts on wildlife population, chimpanzees and gorillas die out. Let's hope not. But if that happened, or if they suffered badly, maybe local authorities would start to impose severe fines and then we would see the result we're all looking for. So there might be a silver lining in the end. Thank you.
Ian, Redmond, would you like to go next?
There's a little like the closing remarks that we were going to end the panel with, but I'm concerned that we've focused, as was our remit, on the impact on ape conservation. But one of the biggest impacts is that we are going to lose colleagues. All of us, everyone on the planet, will within a very short space of time know someone who's has lost a family member, and that's the reality of what we're facing. Someone I was on an expedition with 40 years ago has just died of COVID-19. Another friend has just recovered after the most awful period of being on a ventilator. So our ability to interact with the world as conservationists has got to be balanced between our concern for the animals and the environment and our concerns for people. So one of the worst aspects of this is that we will lose colleagues. And people who travel around the world are probably the ones most likely to get it. Certainly in the recent past, perhaps with the social distancing and the travel restrictions, we're all been put on a level playing field. But the looking for a silver lining, I feel that it might focus people's minds in a way that we would have never been able to get them to do so. A year ago, this moment, Extinction Rebellion was successful in stopping part of central London, and Extinction Rebellion groups around the world brought cities to a standstill, at least in what was then described as bringing cities to a standstill, meaning one or two streets and crossroads. Now, this virus has brought the world to a standstill beyond the wildest fantasies of any environmental activist. So it has brought about an opportunity for change. And perhaps this is the moment for these issues to be brought to the fore. At the same time, those who are still wedded to the old ideas of economic development are desperate to get back to normal, whatever normal was. And their normal was making profits, exploiting the environment, and shunting aside environmental legislation that they felt was hampering progress. So what I sincerely hope is that this gives an opportunity for everyone, decision makers and individuals, because we're all decision makers at some point. When we go into a supermarket, we're taking a decision, which one we buy, which product we buy. But the leaders of countries and of corporations have an opportunity to redefine normal. So everyone wants to get back to normal, but we have to move on to a different normal. And some of those are cultural changes, and I think actually culture can change faster than Vernon was suspecting when there's an impetus. And that impetus, I think, is largely going to be what I've often described as enlightened self-interest. When people realize that this is actually in their own interest, their own family's interest, their friends' interest to behave in a certain way, they will do it because they want to, not because a government or somebody is telling them to. So enlightened self-interest might be stimulated by this virus, but one of the worst aspects of it is the misinformation that is flowing around. So this panel discussion has brought together people who know stuff and are exchanging thoughts. I've certainly learned a lot, and I'm sure everyone else on the panel has, and hopefully those watching it have. But where do we get our information that can inform our decisions when the mainstream media is mainly designed to chase ratings, and documentaries which might upset people and therefore people will reach for the off switch are not shown on the mainstream media? Now, again, the COVID-19 is changing that. Now, every day, our news bulletins are documentaries about this disease and its impact on people. But the wider issues, it's hard to find a good source of information. So this panel discussion is being recorded, and after the recording is over and probably a bit of editing to tidy it up, it will go on to a new site called EcoStreams, EcoStreamz, or Z if you're in America, ecostreams.com. And that is a website that we hope will inform people, because it does have hundreds of documentaries and other materials will become available as it develops, where you can go to find out what the problems are, the details, and more importantly, what the solutions are. So this discussion has been great, because as much as we've been talking about the problems, we've been talking about solutions. And I'm really glad that EcoStreams is going to carry this, because again, we want that to be where people go for good documentary information, and who to contact afterwards, which organizations produce a report, how you can organize a screening of the film if you're moved by it, and make things happen, because it's a time when activists need to get active. And maybe this discussion will help stimulate some of the observers to get engaged with these issues and take better decisions. I wanted to say something when Joe said bats don't spread COVID-19. Some of the misinformation that's circulated has led people who are afraid for their safety to kill bats, to set fire under bat roosts, to put bats that are on sale in markets live in cages onto fires to burn them. Appalling and misinformed behavior, because by doing so, they're probably more likely to ingest some body fluids or breathe in particles of burning bat than if they just leave them in the forest playing their ecological role. So, and others have expressed the view that by talking about the potential for apes to get this disease, we might lead people who are misinformed and frightened to kill apes. Well, the obvious thing is that we have to inform people better so they don't take those wrong decisions, and we can hopefully redefine normal in a way that produces a sustainable future for all of us. That was going to be something like what I was going to say at the end, and we must be running out of time, so take that as my closing remarks. Thank you all for taking part, and all those viewers, but I'll pass over to anyone else who wants to make a short closing comment.
So, Jim, would you like to make a closing comment?
Sure. So one thing, talking about silver linings, I'm going to make a couple points. One, I think a lot of us, or people around the world, have been seeing these images of wildlife congregating in places where they haven't been seen maybe ever, or in a long time, like turtles on the beaches of Brazil, lots of hatchlings, goats and whales, just all these wild animals who are feeling free to be out and about. And so I think that probably, I hope, is telling me, and I hope is telling a lot of other people, that nature is very resilient. If humans disappeared from the planet tomorrow, it would be the best thing for the rest of the species on the planet, because they would just nature would bounce back very, very quickly. So it teaches a lesson that if we change our behavior, that nature can still bounce back. If we treat nature better, if we're better custodians of the planet, and we treat animals and wildlife and the natural ecosystems better than we have been, then we can be more in balance with everything around the world. And so, but I wanted to make a really specific point about here in Liberia. So, Liberia experienced a terrible Ebola outbreak a few years ago. And it really did change behavior here. So there was an incredible paradigm shift in the way people view health. They adopted this whole idea, what I was talking about before, about One Health. So that One Health is this idea that, all health is interconnected. So ecosystem health, animal health, domestic animal health, wildlife health, and human health are all interconnected. And this isn't a new idea. It's actually a very, very old idea that a lot of cultural traditions have. But it's sort of new to us because things have become so specialized. But what happened here in Liberia is that they adopted this idea of One Health, and it's really working. People from the different sectors are communicating, and they're investigating things, whether it's like human health workers working alongside animal health workers, working along wildlife health workers. And it's made a big difference in how people think about their own health and the health of the community. And that happened very fast because, a lot of people died. It was a terrible crisis that the entire country went through. And so what I hope is the entire world is going through the same crisis right now. And I mentioned this earlier, I don't think this has never happened in my lifetime. I mean, there's been wars, but those are localized. There's been bad things that have been happening, but nothing like this, where everyone on the entire planet is suffering from the fear of getting this disease and lockdown, and it's causing massive economic impacts for everyone. And I hope that the silver lining is that there's a paradigm shift in human behavior, the way people think about their relationship with animals, with the planet, with the ecosystems, so that, you know, we can change things for the better for everyone. It will help us, it'll help humans, it'll keep us healthier. Because the fact is, these pandemics, if we don't change our behavior, this is going to keep happening. It's been happening. There's been an increase of pandemics. There's I like to show a sign where we are all in this together, you know, and it's not just us, it's not just humans, it's all the animals and all the whole planet as well. So that's what I think there is really a silver lining. And I think, you know, certainly with the younger generation people are already so included in climate change, and they're already changing their behavior related to that. This is just another symptom of what we're doing that impacts the planet negatively. And I hope what comes out of this is that people will change their behavior so that we can make the planet better for everyone, us and the other species that we share the planet with.
Thank you. That was really great. Gladys, would you like to say your closing remarks?
Yeah, and really, I'm pretty much echoing what everybody else is saying. COVID-19 has happened at such a large scale. Everyone is affected. You know, I've lost 2 aunties in the UK as a result of that. And it's so sad, but everyone has been affected in one way or another. And people have died. Animals can die. And so I think it's a wake-up call for all of us to change our behavior in a big way. And so everything we've discussed in this panel, whether it's improving tourism guidelines to view great apes, whether it's how, you know, stopping live animal markets, you know, on such a commercial scale that they're so stressed in the way that they are, you know, wildlife markets like that. I think it's a big need for us all to change our behavior in a certain way to improve on our public health practices. And there's something else that I also wanted to mention, as James kept talking about the One Health issue. That, for example, in the National Task Force in Uganda, our NGO, Conservation Through Public Health, is part of the task force. We're one of the few conservation organizations there, together with the Uganda Wildlife Authority. They're seeing that it's necessary to have a conservation organization in the task force because they're concerned about disease between people and wildlife. We first joined it with anthrax and Ebola, and now COVID-19 is, you know, we're part of the task force. And I think increasingly we're going to find many multidisciplinary task forces in all the different countries that we're working in order to be able to holistically improve the situation. So I hope that that's one big thing that comes out of this COVID-19 pandemic, to strengthen One Health and other multidisciplinary teams all over the world. We're all in it together, as Jill said.
Thank you, Gladys. I'm really sorry to hear about your aunties. That's terrible, but thank you for your comments. Johannes was wanting to...
Yeah, just very short. Yes, I think it was very nice what Jim said, and it's true. Nature is resilient, but it can only be resilient if we keep our habitats and our species. Once a species is lost, it's lost. And once the habitat for the turtles is gone, it's gone. So we have to make sure that those refugees or refuge habitats still remain. But what I want to say is basically, often in the environmental debate, we are told, oh, conservation is too expensive. Paying for environmental standards is too expensive. It's too expensive. I mean, this is a global crisis with personal impacts on everybody, but it's a huge economic loss. And maybe it's a wake-up call that will tell us, actually, it's cheaper to invest in conservation. And I mean, COVID is a new thing. A lot of more research is needed, but there are many diseases. There's a clear evidence that by having a biodiversity-rich environment, it's also a good protection against emerging diseases. So let me stop here and close here.
Thanks, Ian. And I think we've got one more, no, thank you, Johannes. We've got one more person to hear from, which is Ian Singleton. So if you'd like to speak, say any closing remarks, Ian. Thank you for staying up so late.
Yeah, no problem. Thanks for the opportunity, but I'll try and keep it short. But I just want to say that, again, I feel like I'm the only person here representing the Asia side of thing. And also it's my job as a conservationist, a great ape conservationist, to consider all scenarios. And I'm aware of all the criticism going around the world. I'm watching CNN and BBC and all these different programs, and they're looking in hindsight at what the government did wrong and what it didn't do or what it underestimated. And I can't afford to underestimate here. I have to assume a worst case scenario, and I have to put in procedures and protocols to deal with a worst case scenario. Otherwise, I will be in the same boat and they will be criticizing me. So I am looking at Indonesia here as, I'm from the UK, which is looking like the worst case scenario in Europe, as far as I'm informed, right? And I'm expecting Indonesia to outdo the UK by exponential amounts, right? It's a massive country, 250 people, 17,000 islands, and literally today and tomorrow, everybody is going home to their villages. So this is a real recipe for disaster. Given the scientific evidence that the orangutans are susceptible, I think we are doing them a disservice if we assume they may not get it. We have to assume they are going to get it. And we have to put in procedures in place for when they do get it. At the same time, that costs money. So we have to build facilities, we have to equip our staff, we have to stockpile food, because we can't assume that we will be able to buy fresh fruit a week from now. So we have to stockpile food that is going to be still usable a week from now, even if it's not in the fridge. So we can't buy food that's going to go rotten very quick. We have to stockpile veterinary equipment. We're struggling to get PPE for the veterinary staff, just as all hospitals are all over the UK. And that's a concern for me, the safety of my staff. And at the same time with all this, we're anticipating a massive drop in funding. Somebody mentioned already zoos. Now zoos are all closed in the peak season. They're not getting money. Are they going to be given grants of $20,000, $30,000 for conservation of monkeys in a different country? I doubt it very much. Big grants. We anticipate a drop in revenue, or we've predicted a potential drop in revenue this year of $800,000. So we have a challenge now to try and raise $800,000 from other sources that we've never used before. The question then is, what do you do if we manage to raise that money? What's our priority? Is it the captive animals in our care, which is a few dozen? Right now it's 74 individuals in cages in the quarantine center. Or should we be throwing all of that money into trying to minimize the impacts on the 13,000 or so in the wild? And 13,000 or so in the wild, you might think, well, the disease gets in there, some of them will survive. Well, yeah, maybe, but you remember that Barcelona's football stadium seats 100,000 people, and every single Sumatran orangutan in the world would sit behind the goal at one end of that stadium. One little virus, one bomb, some other impact would wipe them all out in a second. And then we're talking about populations down as little as 750. And they're even less than that because they're fragmented in 570. So this disease has the potential, whether it does or not, but I remind you that it's my job to assume that it might, to wipe out entire populations of great ape species in the next few months. Now, I never dreamed in my life I would say that. And I'm so happy that we've put in measures by reintroducing populations into other areas of the island that might actually help us mitigate that. And I never dreamed I would even be saying that in my lifetime either. But we are. And again, I reiterate, it's my job to assume the worst and prepare for it. Just like it's Boris Johnson's job to assume the worst and prepare for it in the UK, and maybe he has, maybe he hasn't. And it's the same job for Donald Trump in America. And again, has he done it or not? But it's my job to try and do that, and I will do everything in my power to do that. But we have to take this seriously. This disease in Indonesia, which is potentially going to be the worst case scenario of any country I can think of on the entire planet. Once this disease gets hold and goes viral throughout the country, it's going to melt down. It has the potential. I hope it doesn't. Indonesia has surprised me in the past. The tsunami was an amazing feat of recovery. I hope it can do it again, but I have to assume the worst. And the worst is extremely bad. And once it gets into orangutans here, it's going to spread to other animals as well. I go back to the first conversation we had about other species. And I note that most species are extremely sensory orientated. Everything they find on a path, they sniff. So anything that anybody drops in a forest, they sneeze on a tissue, on a piece of wood, they shit on the side of the river. The next animal that comes along sticks its nose within centimeters of that and sniffs it. So the potential of this disease to go nuts in the wild environment, in wild species, is massive. Like I said, maybe you consider this I'm being extremist and panicking, but it's my job to consider all these scenarios, and I need to try and figure out ways to mitigate them. And I think we all need to start thinking the same way. Thank you very much for that opportunity.
So everyone has had a chance to, everyone on the panel has had a chance to say some closing remarks, and we have overrun a bit as usual with our events. So I think it's probably about time to stop the live stream. I'm going to reiterate that a lot of people have been asking about how they can donate and help. We've set up a fundraiser on the Facebook, and we're going to split it equally between everyone here's charities afterwards. At the moment, we've got about just over £200, so thanks guys, that's really nice. And we've also posted a link to being able to buy, people have been asking for the conservation coffee, gorilla conservation coffee that Gladys mentioned. So we've posted a link to that as well under the fundraiser if you want to buy some coffee for yourself. So thank you so much as well to the volunteers, the Ape Alliance volunteers who have been working behind the scenes and passing on your questions and making like banners and thinking about what we're going to have the discussion on, basically doing everything. That's really great. And thank you again to all the panelists who've given up their evening or their sleep to talk about these issues. So thank you very much.
Thank you.
I just wondered if I could thank you, Iona, for being the hostess with the mostess and keeping it all in order and doing all the background work that's pulled all this together. So a big hand for our coordinator.
Thanks, Iona.
Thank you.